lot of challenges with managing dry eye patients. The multifactorial nature of the disease is really at the root of that. So, there's so many different pieces that can go into what's classified as dry eye or ocular surface disease. And really one of the challenges that I think all doctors, no matter even what the disease process is getting that patient to be compliant. Compliance is really important, and I think a lot of times with artificial tears, when we make that recommendation, the patient may hit or miss with the drops occasionally, and I think having a product that they feel relief and an extended relief from is really beneficial. One of the most interesting pieces of DEWS II, and it's a very, very robust document, but one of the most important things that I found in it, and I think that a lot of doctors have recognized, is that when you get down to the point of diagnosis, you may be an aqueous deficient, the patient may be an evaporative type of dryness, but really what DEWS II acknowledged was there's really a continuum between those two conditions, and that continuum is sort of a blend of both aqueous deficient and evaporative. As you're recommending drops in the clinic, it's nice to know that your patients are going to be using those same drops. A lot of times our patients go into pharmacies and they just kind of stand there and don't know what to do. There's too many products on the shelves. And a lot of those products are not necessarily going to fulfill the needs that they have. The great thing about SYSTANE Complete is it's broadly treats both an aqueous deficient and evaporative dry eye patient, so offering it to them and then kind of educating them along with that about why this drop really makes a difference, I think is a great benefit. I take the time to talk about the artificial tears that I prescribe, particularly SYSTANE Complete. And in doing so, I talk a lot about the technology. And you may think the technology of artificial tears won't resonate with patients, but in fact it really does. Oftentimes, if they are interested in the technology itself, I'll talk about how the nanotechnology takes place. Once the patient understands why I'm recommending something, that's when I feel like they're going to go follow through at the pharmacy and get that same thing that I've recommended.